If you've heard that Medicare is suddenly covering weight loss medications like Wegovy or Zepbound for only $50 a month, you're not imagining it. But there's a lot more to the story. Hi, I'm Dr. Ryan Fisher. I'm a board-certified family medicine physician in South Florida. And today I want to explain what we know so far about the new Medicare GLP-1 Bridge Program. One important note before we begin is this is a brand new federal demonstration program. CMS, the Centers for Medicare and Medicaid Services, is continuing to release updates, so some implementation details may change. Today is Friday, July 3, 2026, so if you're watching this later, it's worth checking for the most recent information. So what exactly is the Medicare GLP-1 Bridge Program? Well, historically, Medicare has not covered medications prescribed solely for weight loss. It would often cover these same medications for other FDA-approved indications, like type 2 diabetes or certain cardiovascular diseases, but not obesity by itself. The new Medicare GLP-1 Bridge Program is a temporary demonstration project designed to give some Medicare beneficiaries access to certain weight loss GLP-1 medications at a fixed cost of $50 per month, while CMS gathers information that may help shape future Medicare policy. The current program is scheduled to run through December 31st, 2027. Now, here's where many people get confused. This is not a new Medicare benefit that everyone automatically qualifies for. Instead, it is a separate CMS-run program with its own eligibility requirements and prior authorization process. So who might qualify? First, you generally need to have Medicare prescription drug coverage through Part D, either as a standalone Part D plan or part of a Medicare Advantage plan that includes Part D drug coverage. Second, the medication has to be prescribed specifically for weight management and not another condition that's already covered under the regular Medicare Part D plan benefit. Third, you must meet specific criteria based on your body mass index, also called BMI, and certain health conditions. For example, some people qualify with a BMI of 35 or higher, while others may qualify with a lower BMI if they also have qualifying medical conditions such as prediabetes, a history of heart attack or stroke, or peripheral artery disease. The exact criteria depends on the program's clinical requirements. Who does not qualify? This is where some people may be surprised and disappointed. If you're already receiving one of these GLP-1 medications through your regular Medicare Part D benefit for conditions like type 2 diabetes, moderate to severe obstructive sleep apnea, or certain forms of fatty liver disease, you generally would not be able to use the Bridge program. Those prescriptions would continue to process through your normal Part D drug coverage. Likewise, simply having Medicare doesn't automatically make you eligible. And not every GLP-1 medication is included. Not everyone with obesity will meet the program's clinical requirements. Currently, the medications included are Wegovy injectable and pill, Zepbound quick pen, and Foundayo pills, when they're prescribed for weight management under the Bridge program. Other GLP-1 medications such as Ozempic or Mounjaro are not part of this specific demonstration program for weight loss. If you're wondering whether this program is right for you, here are several important conversations to have with your physician. First, do you actually meet the program's eligibility requirements? Second, are these medications medically appropriate for you? GLP-1 medications can be very effective, but they're not right for everyone. They can cause nausea, vomiting, diarrhea, constipation, and other gastrointestinal side effects. They also have important precautions and may not be appropriate for people with certain medical histories or those taking particular medications. It's also important to talk about the long-term plan. This Bridge program is temporary. Your physician can help you think about what happens after the Bridge program ends and whether your insurance coverage might change and whether another treatment strategy might make more sense for you. Finally, please keep realistic expectations. Even if you qualify, there will still be paperwork. Most patients will require prior authorization, which means your physician must submit documentation showing that you meet the program's criteria before the medication is approved. Availability may also vary at the pharmacy depending on the medication supply and the pharmacy inventory. Also remember, the $50 monthly copay is separate from your regular Medicare Part D benefit. It doesn't count towards your Part D deductible or your out-of-pocket spending for the year. The bottom line is this: the Medicare GLP-1 Bridge Program is an important new opportunity for some Medicare beneficiaries, but it isn't universal, it isn't permanent, and it isn't as simple as many headlines make it sound. If you think you might qualify, schedule a conversation with your own primary care physician. They can review your medical history, your medications, your insurance, and your long-term treatment goals to determine whether this program makes sense for you. And as always, be careful about getting your medical information from social media alone. Programs like this evolve quickly, and your own medical situation is far more important than a one-size-fits-all answer online. As always, I recommend talking with your own primary care physician to see what health information makes sense for you and develop an individualized treatment plan that keeps your health in mind.